is a demonstration of how we can share our own individual researches, because these researches can increase awareness of issues that affect us not only individually, affect us as institutions, and affect us as professions in nursing. We wish to have more of these types of webinars. Henceforth, these fellow nurses, this is an invitation that we wish to do henceforth more often, because we are creating a community of practice. That is the first concept I wish us to realize. This coming together, this webinar is creating a community of practice. This community of practice is one venue by which we can share our issues and problems, by which we can air to everyone here. What we have listened from Kevin and from Dr. Lorena has much of frames of reference of trying to understand the issues of the day. We should have more of this. Congratulations, Kevin. It may not have been a big scale of research, but what you have demonstrated is lived experiences of nurses. I am sure the listeners that we have here, the latest number I have counted is 144, and at FB is 190, and several shares. This is an indication that we are thirsting really to listen to each other. And Kevin, what you have demonstrated is the value of having a critical perspective of understanding the social dimensions of nursing. Take note of that. The value of having a critical perspective. Dr. John Lorena, in his reflections, have demonstrated to us how we can create that critical perspective. So we should go beyond simply gathering this data, but we come up now to a level of analysis to develop that perspective of being critical. It's about time that we speak up. We had always been saying, nurses speak up, nurses speak up. Our concern now is, how do we do that? And by doing so, how can we work together? The challenge has always been, as a leader, how to reduce this, how to cascade this into the grassroots. And dear fellow nurses of Zone 3, nurses who are not members of this chapter, we are very proud to say that we have cascaded a national perspective of what the problems are of nursing. We have cascaded to a zone perspective of how we would want to understand these very issues. And we have cascaded this in the form of creating initiatives on the chapter level where we can work in very specific terms the very concerns and problems that Gavin showed in his research and the very approaches that Dr. Lorena would want us to do. What am I saying? How do we work together is the basic question. Tama na, analyze tayo ng analyze. Paano tayo magtatrabaho? Ano ang pwede nating gawin? That is the most important question of today. How do we do it as Zone 3? Listen, fellow members of Zone 3, because this is how we are going to work together. We have come up with 8 care initiatives. And listen very well, because this will be the strategies by which we would want to challenge you now. So many things have been shared, and it points to one initiative, Care for Carers. Dito sa binahagi ni Kevin, exactly what can we do under Care for Carers initiative? Marami. We can increase awareness. We can empower nurses. We can take care of our nurses, not only from the zone perspective, but go down to very basic institutional perspective and go to the individual nurses. It's about time we listen to them. How do we care for nurses? I know you are doing this in your institution. Pero ang importante ay ipaalam natin sa isa't isa ano ang ginagawa natin under the initiative of care for carers. Number 2 initiative is care for the environment. We're talking about a positive practice environment. I know in our own institutions, we have studies on what the environment is for nurses. We share these studies. We share these observations. We talk about this. Let us put researches together so that we know how we are practicing a positive practice environment. Ano ang pagkukulang natin? Tignan natin at ilagay natin sa number 2 initiative of PNA Zone 3, which is care for the environment. Another is care for linkages. Exactly this is what we are demonstrating here. We see in our chat group that we come from different places. We come not only from Zone 3, Quezon City and Marikina, but there are other chapters listening to that. There are also others who come from the provinces. Let us link together and let us have group conversations for that matter. Let us come up with the concept of kapihan. I see the former President Choi Bondok has said hard to what we are doing now. Very good. I see that St. Luke's Medical Center, Mark Asuncion, is listening now. So I know that from this coming together of different institutions, we can care more for each other because we now are becoming more aware at the institutional level and the interinstitutional level. That is a big care perspective, which is care for linkages. Now, all of this point to another care initiative, which is care for personal and professional development. I-concretize natin yan. Paano natin matutumbok yung care for personal and professional development? Maybe we can be more specific in our webinars henceforth. We talk about legislation. We talk about advocacy. Naiintindihan ba natin ang proseso niyan? So maybe we come up with webinars such as this because it is in lifelong learning. It is continuing education that we gather information, we share knowledge, we talk about strategies, and we share how we are doing these strategies in our own settings. In so doing, it's not only care for personal and professional leadership that we are doing, we are also caring for our chapter, and we are also caring for PNA as an organization. And in effect, if we say we're doing this at PNA Zone 3, then we say, as a chapter, we are contributing to national PNA because this is what we do as a chapter. Then, if we challenge our fellow chapters and talk about the same issues, then we can increase the collective voice. What I am saying is, we go beyond these discussions theoretically. We come up with data. And what is that saying? Let us come up with researches. Maybe we can come up with simple researches, as simple as count researches. Ano ba ang nurse-patient ratio ninyo? Magkano ba ang sweldo nyo? Ano ang mga benefits ninyo? Isulat natin yan. Huwag tayong matakot. I-compare natin sa isa't isa. Dito sa institution na ito, ganito ang salary nila. Dito sa institution na ito, ganito ang benefits nila. And let us publish them. It is by publishing this that our administrators will get to find out, nanguhuli na pala kami. Kaya pala walang nurses na nag-a-apply dito sa institution namin. Kasi dito sa medical center na ito, ang laki ng sweldo nila. Masasaya ang mga nurses nila. So you see, what are we doing? Through the little researches that we do, we can conscientize our fellow stakeholders in health and the health profession and in nursing for that matter. So, studies and policies, studies and standards, studies and practices, yun lang. reporting lang ang gagawin natin. Matitignan na natin kung meron ba tayong so-called dignity for the nurse that we are giving. Nakikita pa natin yung wage gap. Then we will be able to document ano yung pinag-uusapan natin ng dignity gap for that matter. So, my dear nurses, what are we doing at PNA Zone 3? We are trying to work at the grassroots. We are so many institutions in Quezon City and Marikina. We would want to cluster membership according to political districts. There are political districts of Quezon City. There are political districts of Marikina para alam natin kung sino ang mga political figures natin na pwede nating lapitan and let us talk about health issues. And maybe one approach that is doable is let us aspire to become members of health boards. Or maybe let us aspire to be a nurse at the barangay level. Let us know the barangay law for that matter. Is this doable? It is very, very doable. So at the grassroots of the barangay, at the grassroots of the city, at the grassroots of the LGU, we understand what policy is. We understand what policy research is. And we understand what policy formulation is. And maybe in our own institutions, we can start with a very, very basic, which is coming up with definition of our own problems and maybe coming up with a small-scale research and maybe eventually coming up with a position statement. Is that doable? It should be doable. Now, I end up by saying, these are stepping stones by which we can appreciate advocacy for that matter. We should be politically involved. That became a very big question during this election. Kasi sabi natin, we are a nursing organization. We are apolitical. We are non-partisan. Well, yes and no. But you see, our social issues are political issues. It is only when we make a stand and be brave enough. And I would want us to be very clear in our minds. Have we made up a stand as a nursing group? Well, maybe yes, maybe no. Maybe we need a stronger voice. It is by making a stand, but that makes you different. It is only by making a stand that makes an individual nurse different. Kaya, huwag na tayong reklamo ng reklamo. Mag-stand up na tayo. Manindigan na tayo. And I wish to end up by inspiring everyone. It is the moral courage that should define every nurse. It is only with moral courage that we can address the problems and issues of the social dimensions of care. Thank you, Kevin. Thank you, John. This is a very good perspective on which we can make more discussions. Thank you.
All right, so thank you so much, Ma'am Betty Merritt, for that very passionate sharing of your insights on our topic for tonight. So before we continue, let me just acknowledge